Hello again, Stewart Gandolf here with another podcast. Welcome, everybody. Today we have another guest that has been recently introduced to me, and I'm excited to have Martin join us. Martin Price is CEO of HealthTrackRx, or sometimes known as HealthTracks, depending on who you're talking to. First of all, welcome, Martin.
Thank you for having me, Stuart.
Very good. I'm really pleased to have you today. I'm going to move my notes over here really quickly. So, Martin, um, we've met recently. I'm really intrigued with your story. So I'd love to just start by telling us a little bit about your background and Health Track RX, and let us just start there.
Sure. So personally, Martin Price, I've been on the provider side of healthcare for about a decade, both in the clinical diagnostic space as well as emergency medicine, healthcare IT. Prior to that, I was actually a practicing lawyer at a law firm here in Washington, D.C. for about a decade, working with healthcare companies on complex regulatory, transactional, commercial work.
Oh,
I've been with Health Track RX since 2020. What's Health Track RX? We are the nation's largest molecular testing lab for infectious disease. So, what does that mean? Each day, thousands of patients walk into urgent cares, clinics, pediatrics, women's health centers with symptoms of infection. And those physicians can swab their patients, send their samples to our lab, and the next day we provide a PCR-based answer to what's causing the infection and whether and how they may choose to treat it. Our business has existed since around 2010. We operate in all 48 states in the US, or 48 continental states. Each day we service about 5,000 unique facilities or rooftops, and process anywhere between 10 and 15,000 patient samples. So think about 2 to 3 million patient samples a year.
wow, that's impressive. So, and there's a lot of stories to talk about here, particularly COVID, but we have some things that are even more interesting and current to talk about today. So, one of the reasons why we talked on our when we spoke last time, we dove down into this world of testing and infection treatment, and so help our listeners understand like what's wrong with the traditional way we, diagnose and treat infections.
Yeah, so it's a great question. It's really sort of the basis of why we exist. So, historically, diagnostic tools for infection have just been either too slow or ineffective. Physicians had really kind of limited tools in the office. So you've been to your physician offices and you have what may be a respiratory infection. They could give you a strep test, a flu test, what's called an antigen test. Um, but if that didn't identify what was wrong with you, they really had two choices: send out to a large reference lab for a culture, literally culture that specimen, that sample, and grow it until they could identify what it was and how to treat it. And that can take 3 to 14 days. Or simply write you a prescription for a powerful broad spectrum antibiotic. The logic being, let's just kill everything that may be potentially causing this patient's symptoms. The problem is that for about a third of the time of those infections, the antibiotics aren't needed at all. And because of the lack of tools, this overprescribing has resulted in so many of these common strains mutating to now be resistant to the common antibiotics you and I are familiar with, the amoxicillins, the Bactrums. So you have all these strains now floating around in the community that have just developed resistance to them. So many times the prescription is not needed. And even when one is now written, it's just not going to work. And so without better information around, do I need a prescription? And if so, is what I'm being prescribed actually going to be effective for what's causing my symptoms? Patients are still left to sort of, and physicians left to kind of guesswork as to how to treat this problem. And, as we've all experienced, what does that lead to? It leads to patients having symptoms longer. It leads to those symptoms becoming more severe and landing that patient in an ER or back in their physician office. So it's really just it's been the lack of timely enough tools to give a proper, effective diagnosis.
So one of the things I want to pivot on that just for a moment and speak as a patient, and I think a lot of our listeners will relate to this. So my experience on this is, first of all, and most providers we talk to will commiserate that, I don't know what percentage of patients understand the whole, virus versus bacterium and antibiotics, but a whole bunch of people don't, right? So that's a source of stress for the provider right there. I want antibiotics. We don't know if you need antibiotics. So that whole thing. So that right there is not a patient experience, builder. Um, so in my own experience, I have found that, for example, for whatever reason, every time I've been prescribed amoxicillin, it hasn't worked for me. So I don't know if it's just bad luck or maybe somehow I personally, it doesn't work with me, but it just hasn't worked. They always have to do something else. So there's that. The second thing that I noticed though is that depending on where you go, some people just, pass out antibiotics like candy. Others are really, really conservative, like, and as a patient, overly conservative. So I had a PCP for a while there that I had a lung infection for months. He said, it'll just resolve itself. Like, okay, I don't know. That's not really the right answer. So it's not super great for either side. And certainly we don't want to contribute to the antibiotic resistance of various bugs, right? That's a real problem. It's very scary. Anytime anybody's looked at this very seriously, it's a scary problem. So I think the stakes are high, which is part of the reason why I was so intrigued when we first met. So the obviously you're here, you have some ideas. So how do you guys address these challenges?
Well, so and the situation you described is of course not uncommon, and it's rooted in a lack of information. Physicians want to make smart choices. They want to provide answers, clarity, and therapy for patients that are going to work. But when they don't have tools and when they don't have information, they're left to either prescribe blindly or not prescribe and sort of hope the patient gets better and doesn't come back. And that's those are two awful from a patient outcome and healthcare perspective. Those are two sort of awful outcomes. So where do we come in? Our solution is rooted in molecular diagnostics, PCR, reverse transcription diagnostics. This advanced technology can help identify exactly whether a sample or a specimen is viral, bacterial, or fungal, and whether that particular pathogen is resistant to common antibiotics, and if so, which ones? And if so, which ones is it not resistant to? PCR has been around for a long time. Most folks weren't familiar with it prior to COVID. It's kind of entered the common vernacular during COVID. People recognized a PCR result was now sort of the gold standard of infection detection. Where we made that paradigm shift was not utilizing PCR testing for infectious disease testing. It was building out a logistics and operational platform to deliver a comprehensive PCR result to any patient anywhere in the country by the next morning. So rather than waiting a week for test results or starting an antibiotic regimen, we can deliver an actual answer to your primary care doctor or to any physician who is uh, confronted with a patient who's got real symptoms and wants answers and wants to know that when they start a prescription regimen, it's actually going to get them on the pathway to recovery. So it's really been for us stitching together a technology that's been around for a while, leveraging the popularity and adoption of it as a gold standard for detection during COVID, and then applying the logistics operational workflow to really deliver that at scale anywhere in the country the next morning.
That's fantastic. And then, so how did you do that? Like, to be able to turn it around that quickly? What are and the scaling it when you're talking about national?
Yeah, so there's a longer version of it because as like most things, we kind of got there in fits and starts, and but kind of ultimately to bring those capabilities everywhere, we partnered with UPS Healthcare back in 2022. UPS Healthcare, UPS or UPS, everyone's familiar with UPS. They touch every corner of the country, and so we launched a pilot project with them in Louisville back in 2022 as part of a program they run with a select number of healthcare companies to help expedite the return of diagnostic results. So backing up 1 second, backing up just a moment. We used UPS before, and typically what that meant is UPS would pick up a package from a physician office. You're in New York, I think. Is that right, Stuart?
We're in California, but yeah,
Oh, I'm sorry, in California. Would pick up a package from you in California, would fly it and deliver it to us in Texas, where our lab was located. We get there around 9 o'clock the next morning. The PCR process takes about 7 hours to deliver that comprehensive result. That meant we really couldn't get a result back to you in California the next day. You would get it after 5 p.m. Your physician's probably gone home for the day. What their solution in Louisville offered was every UPS early morning package in the country runs through Louisville. They operate a hub and spoke model the same way that FedEx does. FedEx does it in Memphis. So every plane, whether you're going from Los Angeles to San Diego or San Francisco to Los Angeles, that package is first going to Louisville and then back out to the West Coast. So the solution they offered for us was we can actually pull your bags off the plane mid-route and deliver it to you on the runway at about 1 o'clock in the morning. So you
Wow.
can start running your samples at 1:30. That then allows you, even within those 7 hours, to have when a physician arrives the next morning at 9 a.m., that result is waiting for them. And that really changed the paradigm in terms of waiting 2, sometimes 3 days for a result using PCR to now being able to have a result the next morning. You walk into your clinic this afternoon, whether it's in California or Maine or Florida, Texas, or a remote place like Fargo, North Dakota, if UPS picks up, and they will pick up pretty much anywhere, they can get it to us by 1 o'clock in the morning. We can deliver a result, and that's the logistics component of it. Of course, the workflow from our perspective is being able to operate an overnight lab at scale, and that requires a lot of automated tools. So if a visit to our lab, you'd see robotic arms moving samples around at high velocity so that no steps are missed along the way. And of course, being able to reducing our reliance on having to have people touch the samples, engage in the process throughout the course. So it's really, like I said, it's the stitching together of a couple of complex pieces to ultimately deliver a pretty simple thing, which is you go into your clinic, after this interview, you go get swabbed. We'll get your physician a result tomorrow morning.
That's fascinating. By the way, congratulations. I love when I talk to people that have thought of something truly big and innovative, and that's a big idea. And I'm sure it wasn't easy, but it's pretty impressive. So let's talk about the impact. How have things changed?
Um, Well, how has it changed? Let's think about how has it changed for providers? So, that was the most important thing. We can move mountains and we can do all this other, what we think of as really interesting stuff. But if ultimately physicians are just writing a script anyway, when they see the patient, then we really aren't making an impact. So, how we measure it and where it's really has made an impact is we find today about 2/3 of our clinicians will withhold writing a prescription when the patient visits, or give them just a single dose and say, I'm going to reach out to you in the morning and let you know if you need a prescription. I'm going to tell you what you have. I'm going to tell you why I'm not prescribing, or if I am prescribing, why I'm prescribing what I am. That is really the paradigm. That has really been the output change from this, is having clinicians buy into a more thoughtful, information-based approach to therapy. And that's what the tool enables them to do. And for patients who now more and more are driving self-directed care, like, they want to know what they have. Most folks now don't want to just go in and take amoxicillin. You've had your experience with it. It's not going to work. Bactrim, maybe it's a little bit better in some cases, maybe not. You want to know what's causing it. Is it stress? Is it pneumonia? Is it something else? Is it COVID? Could be a whole bunch of things. I want to know what I have. I want to feel confident that what my physician is prescribing for me is actually going to do me some good. Um, so that's been the real impact for us from a patient and provider perspective. From a broader healthcare perspective, we've had a couple of papers published both by us and from third parties showing that early intervention of rapid diagnostics really does change the cost curve too of healthcare, because you're having fewer of those repeat visits to physician offices. You're having fewer people show up in the ER. You're having fewer medications prescribed. So you're getting better outcomes at lower cost. For our business, it's been uh, growth. We've had, you know, early adopters have become champions for us in the marketplace. Many of the larger urgent care chains and operators today in the U.S. now work with us. That's been our primary call point, and more we're seeing patients go into offices or hearing about this and saying, "Do you have PCR testing?" As opposed to, "Hey doc, tell me tell me what you'd recommend here." And that's what really kind of, I think, has fueled our growth so far. We'll continue to drive it.
That's great. So, this is a healthcare podcast, and I always talk about it's, part business, part marketing, but I have to come back to the marketing part. So, I'd love to know, there's a little bit to unpack here from a B2B and a B2C perspective. So, take whichever order you like. Tell us a little bit about the marketing, how marketing plays a role with your business's growth today.
Yeah. So marketing is essential really for, I mean, a couple of reasons. Foremost is we are approaching physicians who have been trained and practiced in a particular way for years. And it's always a hard conversion to say, "Hey, there's a new technology, there's a better way," without crossing that line into what you're practicing really isn't the standard of care today. You're really not delivering great service for your patients. And so being able to develop a message around, here are some tools to enhance what you're doing. Here are some tools that will actually improve your workflow, your patient satisfaction, the Yelp scores you're going to get online, that's going to drive traffic to your clinic. Ways in which we can get at driving adoption without the sort of stick approach of, the guidelines say the gold standard is to run a molecular test, and yet you're not. And we know you're not, and you're not. But that's not a healthy conversation.
Yeah,
So
that's going to go over great.
it's all the
You were doing
different
so
way.
well, Martin, until now.
So it's all the different ways you come in and you say, "Hey, there's you're confronted with a whole lot of challenges operating an outpatient clinic, whether it's primary care, urgent care, pediatrics. There's tools we can help you with, and it helps both in the diagnostics, it helps in the therapy, it helps in managing your workflow, and it will help ultimately in the business of your clinic, because patients are coming in, they're walking into an urgent care because they want access, they want speed, they want affordability. We can play into that. Our value prop is the same. We can support what you're doing, but it's a careful message. And our marketing team has developed, marketing communications team has developed talk tracks that go directly to providers, that our sales personnel go out and talk through, that our clinical team, we have a team of PhD folks in-house that will go and talk to folks, because many of them weren't schooled in how molecular diagnostics can work. And so they need help in unpacking a test result from HealthTrackRx as opposed to a culture that maybe was that they were used to before. So we really come at it from a whole variety of different ways. And I'll share one other example of so the marketing of it. When we launched this initially, and this was actually before we moved to Louisville, the first place we threw down our flag was in Atlanta to try this next morning model. We had a heavy concentration of customers in the Atlanta market. So we built a small lab in Atlanta, and each night we would run couriers from those offices to our lab and do an overnight and deliver a next morning result. Kind of our own little pilot project of how would this work. Within several months, the two largest urgent care chains in Georgia, you could drive down I-75 and you would see on their billboard featuring next morning PCR testing. Like
Wow.
they then saw this was a differentiator for us that can actually drive traffic and drive better patient service to them. So there's a lot of aspects of how the marketing piece has been really critical for us.
That's fantastic. So I want to unpack a couple different things there. So you going on the B2C side first. You were talking about, and I was wondering about that because we didn't talk about that last time on the prep call. The satisfaction scores will go up. That's kind of an intangible. You can look at some reviews, sort of spot check it, see people are overall satisfied. You can get some feedback from that. And there are different tools for reputation management. You can probably look for keywords. And so that probably was that alone is helpful, right? Especially in areas like urgent care where reviews and online searches are so important. But the other thing that I thought was really interesting that you just said there is I wonder how many of these chains have figured out how to promote that as a benefit to patients, as a differentiating factor. And it sounds like they did, which was really fast and it's great. Patients, you're right. The public has certainly learned a lot more about testing since COVID, and the idea that wait, I didn't think you could do that overnight. How did they do that? So it's you're now think about how far we've come from not even knowing something exists to understanding the feature of it, then to understand wait, that's different, and then the benefit. That's a lot. So that's happened very fast. So that's an exciting ride. Do you find other of your client institutions are doing that? Because it is compelling. Like if I had a choice between urgent cares and I knew that was a difference and I was feeling sick, and like I said, I'm sure everybody has their story when it comes to this stuff, right? Like I could just really do remember being sick for months when, took finally coughed up, pun intended, script, and then the antibiotics worked. But I waited for 2, 3 months before, and I get it, but like that's a long time. So, you know, are you seeing that as a trend? Do you feel like that's an important issue for the clinics that are acquiring, or no? Or is it just sort of an adjunct?
No, I mean, I think the urgent care market is obviously a huge area of growth in healthcare delivery. The folks are that has spawned from virtually non-existent to now there's something like 15,000 urgent care clinics around the country, and even urgent care is turning into kind of urgent care and primary care. I mean, folks want access, so that model is growing. But where do folks find urgent care? Where do they decide when to go? They hop into they're not feeling well, and they get on Google, they get on Yahoo, and they go, who's near me, and what are the ratings? This place I'm going to feel confident going to. So they live and die by their Yelp ratings. You talk to any urgent care operator, and that NPS or Yelp score is the only thing they really care about. Yes, of course, there's a whole bunch of quality, safety, outcome data points that sort of drive their reimbursement on the insurance side. But in terms of actually scaling their business, getting repeat customers, drawing more customers into their clinics, it is what does their online profile look like? And what they don't want is I went to a doc and I just got a prescription, I ended up in the ER, or I went to a doc and I waited 3 weeks for a lab result and I got a big bill from my laboratory. They want to have a positive, they want that end-to-end positive experience from their patient. I went in, I got diagnosed quickly. I knew what it was going to cost me. I got a result the next morning. As a lab, as a reference, as a send out lab for these clinics, 98% of the patients, probably 99, have no idea who HealthTrackRx is. Uh, and that's okay. That's okay. That's okay with us.
Yeah.
We have some marketing in a lot of our clinic offices. And the only time they ever tend to hear from us is when we send their claim through an insurance company and there's a patient responsibility. And now they're getting a bill from HealthTrackRx. Um, but what's helpful is, we'll engage, and this is really going a little bit beyond your question, is that's oftentimes often a bad experience for patients. You go in, you see a doctor, you go into the ER, and then months later, you're getting a whole bunch of bills from a variety of organizations and entities you had no idea touched your visit. So what we do is when you go into an urgent care, we will literally reach out to you. We'll text you, we'll send you an email saying, we're Health Track RX. We have your sample. We're going to deliver a result to your physician the next morning. If you have insurance, you may never hear from us again. Or you may get, or once you have, if there's a patient responsibility, we may reach out. You may get a bill from us at some point. So, engaging that's sort of the extent to which we engage with the patient, but it's so it's letting them know we have their sample. Most probably disregard that. They just want to hear from the physician. Um, but we want to sort of build some of that connective tissue because the way healthcare works, we may have to be back in front of them in 30 days and say, hey, you owe us $75. You have a $15 copay, whatever it may be. And we want them to associate that with the positive experience they had with getting a result that was actionable the next day.
Love it. And on the B2B side, we talked prior to the call, and it's interesting because, as you may know, or we discussed, our agency works with multi-location providers, and one of our largest is a multi-location, one of the big ones for urgent care. And so we know that business very, very well. And I think it made a lot of sense for you guys to go after the big ones first, right? You're all about scaling. I joke about this and some of our webinars we've talked about the idea of going around and knocking on doctor doors one by one is sort of blow your brains out fun, right? It's just it's very, very hard to scale that, and it's harder and harder to scale that today. So going to larger chains, you're solving two different problems from a strategy standpoint. They're more likely to give you a lot of business. It's easier to make the sale once than to make it 100 times or 1,000 times. And also, you alluded to this a little bit, getting the educational part done is important, right? You're educating, you've got the backing of the large institution. You don't have to go convince each doctor one at a time, this is a good idea. It becomes an operational sort of process thing, which makes sense. So I think that's brilliant. I'm curious, without giving away anything too confidential, are you guys using, a field source? Do you guys have a ground team that goes out there? Are you using digital marketing? Like, how are you reaching out to new business? Again, nothing too confidential, but just broadly.
Yeah, no, I mean we have a sort of a variety of tools, but the largest is we have a sales force of about 150 people.
Yeah.
And they are segmenting the market to target at different levels. We have a certain group that is specifically focused on what you described, which is these large multi-site, multi-state operators. Um, you may know this from your work in the space. It was a stunning statistic for me that 72% of the urgent care clinics in the country are single shop businesses. So it is, unfortunately for us, there is the sort of the high class work of going to the sophisticated professional multi-site that have strong infrastructure to deliver a clinical message, to engage operationally to ensure there are proper supplies in all locations and good feedback around what a patient outcome has been, how can we provide better service. But the bulk of it still in healthcare in the US is that door to door single door swing. Hey
Yep.
doc, during, we know you probably see a lot of patients who have symptoms. Have you thought, are you familiar with the technology and the service that we offer, et cetera? We do a lot of direct online marketing, or online communications around, hey, it's respiratory season. PCR testing is a differentiated tool for respiratory disease infection. So we do some of that on social media directly to providers. We do, reaching consumers is tough for us. And so most of that is directed at business. Go to
Yep.
conferences like Urgent Care Association has conference, AAPM, Pediatric Medicine has conferences, and we join some of those, some of the groups within that and try to market and communicate through there. We try to get some of our clinicians on speaking panels at these things and put out webinars around, what are some of the new developments in infectious disease testing, whether it's in genitourinary, whether it's in respiratory, whether it's in something else. Um, it's really about for us educating the market. I think once folks learn a little bit about what we do, um, they see that it's not a fly by night or a new sort of a new gizmo that's trying to sell them on something, but that this is being widely adopted today. Most of the major urgent care chains, tens of thousands of patients are seeing this every week. Lots of providers at the Infectious Disease Society of America heavily engaged in how do we drive faster diagnostics. This isn't this isn't kind of new. Not this isn't stuff that we're just trying on for size. This is a really, it's actually you're missing out. You're the one, you're sort of falling behind where your peers are going. And we try to hit that through as many different channels as we can.
So a couple of thoughts there. You know, exactly what you described, knocking on individual doors is hard, labor intensive, difficult. If you could wait in a lobby for an hour or two trying to reach the doctor that's in charge. So there's that whole dynamic. The other thing is that you alluded to that, if you haven't been trained on this, it's like, primary care doctors and urgent care more specifically, like it's an impossible job. You're supposed to know everything about everything. And people are any group of humans are habitual. Everybody's, doctors too. So if they've got a habit, it's hard to break it. And so, or to even think about it, right? Just the way you do things. So I think that's an interesting challenge. A couple more questions. Well, first of all, just curious. So it's funny, we were just talking about the Urgent Care Association. So we're participating in this year. I just literally on the call before this, I told you I was running late. We're talking about our conference schedule. So maybe I'll see you in Dallas this year. I'm assuming you'll be there. Uh,
We will be in Dallas, and then they have the Northeast Regional Urgent Care Association, NARUCA. They got Saruca. I mean, it is really hard to practice medicine these days. It is hard for these providers. They are, their reimbursement is being hit. Their hours are getting longer. The the pressures on them are really difficult, and to expect them to keep up with every new technology that's coming down the road and be able to distill from which ones are going to be impactful and which ones are not, that's hard.
yeah.
And so my sort of tongue-in-cheek comments before earlier around, you're not practicing the gold standard of medicine today. That's not a knock on these guys. That's our opportunity to go and educate them,
Yeah.
because and to make it and to do so effectively, because they have every pharma company, every device company, every diagnostic company is knocking on their door with something new and novel, saying, "Hey, I got a better mousetrap for you." Our challenge is to distinguish ourselves from that group and deliver a message that they can connect to and go, "Okay, I'm willing to learn. I'm willing to listen." Um, but that's a hard first gate to get through when you're dealing with someone who's probably overworked, as patients waiting, sitting in the waiting room, and I'm one of our sales reps is probably the last person they want to talk to. So we got to
Yep.
be really effective at delivering a message right out of the gate, connecting with them in a couple different ways, so they'll take that initial meeting.
So, fun fact, we have a webinar about digital marketing to HCPs and other doctors, or doctors and HCPs. And the first slide is essentially reaching doctors is hard. And they're protected by the best gatekeepers on the planet. Everyone wants a piece of them, not just you guys, but pharmaceuticals, other practices, real estate salespeople, insurance salespeople, jewelry sales. I mean, every salesperson on the planet. Then you've got billing issues and I was just talking, we interviewed a leading oncologist recently. He said, one minute I just told somebody they're dying, the next minute I'm worried about their MRI. Now you pop in. It's really difficult, right, to be able to cut through that clutter. And so, and you alluded to it. We could talk about this more another day. So we often talk about using digital marketing as air war to help support the ground troops so that they're not just
Mhm.
hearing it the first time, which can be a really good combination. But you need those ground troops because the air war won't do it by itself. But if you have the ground troops, the air war, paid social, programmatic, email, all those things can really help build that. And these issues, by the way, Martin, every one of our B2B, we work probably about two-thirds B2C, a third B2B. in every single B2B, these are the issues we talk about all the time. I've got something great. How do I let my doctors know about this? And how do I get them to think about this? And it's a really common thing. Two last questions. One that you alluded to earlier. Another thing that, we do a lot of internal trainings and we're always getting new people coming in. And so I was just working through, we call it Healthcare Success University, talking about, value-based care and ACO and capitation and all these things where it's not really fee for service, it's more about keeping people healthy. And so you kind of alluded to that, the overall cost savings. And I could see how, well, if you get an infection early, they don't end up in the hospital. Overall, it's going to be a pretty good thing. So are you feeling the love from health plans or anybody else? Because there's that side of the story too.
I'm not sure anyone feels a lot of love from health plans, um,
Good answer. Good answer.
but our whole business is around how do we reduce the cost of this service. Getting good care shouldn't be a 500, it shouldn't be a $500 episode, whether it's for a healthcare plan or whether it's for an individual. This should be 100, this should be a 50, $150 test, period. And with scale, we can continue to drive the cost down. So we both show the benefits, the economic benefits of early intervention, and part of that is being able to properly educate clinicians on when to utilize a test like this. Not every patient needs a send out molecular test, and if you're using this as a screening test or screening tool when you have other tests available in the office, strep or flu, then you're kind of going to lose that economic advantage or benefit of send out. So the onus is on us to really drive good education and tools to help clinicians know when to send it out, to deliver it at a cost effective way. We go into health plans and say, I want to be your low cost provider for send out infectious disease testing. I will take, well, whatever you're paying somebody else, I will take $1 less than that. Because we want you to view us as someone who's actually trying to help solve the broader problem, not trying to be, yet another sort of parasite on the system of where do I get my piece of this? And and so we have had really good clinical conversations and paired research conversations and output and outcomes with health plans because we'll say, listen, we'll go at risk. We actually think that our product, if properly used, will drive down your cost, and we will take risk on that. So we will give it to you for less than it costs us health plan, um, in exchange for in the value-based care operators, in exchange for some contribution when we demonstrate the value. And that's been pretty unique in diagnostics. That has come up in a lot of other areas of healthcare, but they tend to be pretty surprised when a diagnostic, particularly a reference lab, comes in with that conversation. But it's absolutely critical. I mean, we have got to, um, if we're not viewed favorably by health plans as being accretive to what they're trying to do, they can be a real barrier to growth. I'll share one stat that's been really helpful for us to scale, which is 80% of the time a patient with insurance gets a sample with us, they do not get a bill from their insurance provider because it is a fully covered service. And that kind of speaks to our ability to both engage clinically with the value of the service we're offering, and also keep the cost at a point, keep the cost low enough that the health plans are willing to pay for it. And that's been sort of the validation of that messaging to the health plans and that partnership with the health plans. Because, as you know, for in many areas of healthcare, you have a lot of different customers. You say B2C, who is our customer? We got a patient, we have a clinic, but the person who actually pays us is sitting in Minnesota at United Healthcare, or sitting in Louisville at Humana or somewhere else. That's who pays our bills. Uh, and we have to be demonstrating to them every day that we're delivering a quality product that's changing behavior, that's changing outcomes, and that our cost is not, that our cost is reasonable.
That's great. All right. So last question, forward looking, what's next for you guys?
At the moment, we are, well, two things. We are really heads down in growing within our base. Today we have what I think of as a big operation. We have hit only a small number of physicians today. We probably have 10 to 15% of the urgent care market. There's really no one else delivering this service today out there. So it's kind of guerrilla tactics to go out to the Urgent Care Association conference, identify those large groups we're not working with today, and continue to scale so that this does become the standard of care. Today, in an academic or medical journal, will say rapid molecular diagnostics is a standard of care, but you walk into two-thirds of your urgent care or health clinics today and not get that. So it's really a push to drive adoption, smart through education. So smart adoption. The other interesting thing we're doing is UPS. UPS in an effort to drive their healthcare. I don't know if you saw this week in the paper, or maybe it was last, I think it was earlier this week. CEO of UPS talked about weaning off of Amazon and focusing more on healthcare. And one of the elements of that is they've actually built a lab campus in Louisville adjacent to the airport as part of their broader facility. So we are the flagship tenant of that, what they call LabPort, and that facility will open
Wow.
in May of this year, and we will move all of our operations to the LabPort facility and sort of further build our connective tissue with UPS. And for us, what that means is obviously UPS has a footprint not only in the U.S., but they have planes flying into Louisville from almost every country in the world every night. They also have uh, somewhere between 4 and 5,000 UPS stores or facilities and drop-off locations around the country. And so through that partnership, there are lots of other ways in which we can reach patients, whether that's directly to the patient or whether those are patients that are outside the US. So a lot of kind of interesting things in the pipeline as we build that sort of deeper relationship with UPS.
Fantastic. Very exciting. I'm glad we spent some time together today. It's funny because I usually send my team to the conferences. I may come to Dallas just to say hi to you, get a cup of coffee or a glass of wine or something. I really enjoyed
That
it.
that would be great. We're hosting a welcome dinner for a lot of the folks on the first night there. Because Dallas has been our home base for a long time. So the UCA conference has been Las Vegas the last 4 or 5 years. This year's first year somewhere else. It's in our what we think of as our backyard in Dallas. So I'd love to have you.
Yeah, it's fun. It's the yeah, this is so bizarre that we're just talking about this. But wait, it's not in Vegas this year, it's in Dallas. We just had that conversation. So
Yeah,
great, Martin. Enjoyed talking to you. Hope to see you in the near future face to face. That would be fun. Great
awesome.
job. I think it's a really compelling interview. Thank you.
We'll stay in touch. Thanks for the time. Enjoyed talking to you.
All
Bye.
right, great. Take care.